And March is Social Work Month.
And the slogan for this year is "Social workers are essential," and it couldn't be more fitting, especially during the pandemic.
It's not glamorous, and it's often, we see people on their worst days.
But the role is a fulfilling one for Allison Tefelsky, a medical social worker in the emergency department at Spectrum Health Butterworth.
There are certain patients that just, you feel like you made a difference that particular day. And they tell you that you did.
Tefelsky wears a lot of different hats, from acting as a liaison between family members and the medical team to behavioral health and suicide assessments, something she's been doing more of in the time of COVID.
We're seeing a lot more people who are struggling with depression and anxiety and suicidal thoughts. I feel like we're also seeing probably a little bit more of actual attempts. And just dealing with people who are struggling, who maybe didn't have that problem prior to the pandemic.
Leah Quintanilla, the clinical supervisor of Spectrum's ambulatory behavioral health department, is seeing similar issues in the primary care setting too.
Definitely, we've seen a lot more patients come in with what we call more like adjustment disorders. So because of the pandemic, being isolated, not being able to be around family members, some not able to work and that type of thing, or being fearful of getting COVID or a family member's getting COVID and those types of things.
Quintanilla says they often connect people to community resources and support patients in crisis, adding that there's been at least one good thing to come from the pandemic.
It's opened up the capability for our team to utilize virtual visits, which has been amazing because a lot more patients are able to have access to our services that maybe weren't able to have access before.
The past year certainly proving just how essential their work is.
Just recognizing that, mental health concerns, behavioral health concerns, and those types of things don't go away when there's a pandemic, just like medical health conditions and, emergencies don't go away.
And we should note that all Spectrum Health primary care providers do depression and anxiety screenings during their visits, and then they can connect you with a social worker if you need a little bit of extra help or getting connected with community resources. They are so vital to the healthcare system and also outside the healthcare system. So kudos to them, and we're happy to celebrate March with you.
Absolutely. Thank you for everything you've done this year.